you very much. Also, thank you for having me and for attending this wonderful webinar, which is also very interesting for us. I will not tell the entire story about how Belgium tackled COVID until now, but the only thing I want to say is that since the 1st of July, there was a big relaxation of most of the rules. And the 16th of July already, we saw in Antwerp there was a big increase. So the doctors called us and mentioned that they had a lot of pressure in their practices, and so seeing a lot of people testing positive. So they gave a first warning sign, oh, something needs to be done. Then we started in Antwerp with, and I focus on that because it's also, I think, important as a complementary story to what Bart Preneel mentioned. So we started in Antwerp with a local contact tracing and also a local source control, or we tried at least, or the doctors tried at least, to step by step get more view on who is being infected where. So it was a very, how should I say it, manual work. So it's like, well, not easy to tackle, of course, so you need much more than that. And at the same time, Flanders, so the region of Flanders, started to work with a more general, generic way of contact tracing and of source research, which was not elaborated that much yet, which is still not the case, and which is, I think, still an issue. Just to mention that, and I tell the story due to the fact that Kathleen mentioned that how important it is to have personalized preventive healthcare. Due to the fact that we have like a proportionate universalism, it's very tough to work with generic approaches to also reach people in more vulnerable communities, more remoted, social economically not as well developed. And I can also imagine that also for the use of the app, it is a community, or there are communities where we have to take particular attention at, also due to the fact that the language might be an issue, so it might not be too complicated. So it always is an and. And now I will mention, no, still one thing more. As you know, that in Antwerp the figures increased tremendously the 26th to 27th of July. So that was the reason why we had to take severe measures in Antwerp. Very severe measures in the sense that bar and restaurants had to close at 11 p.m. There was a curfew from 11:30 p.m. until 6 o'clock in the morning. The mouth nose masks were universally obliged. There were some legislation and measures on sports, restrictions on sport, teleworking, and also the most impacted zone there we had like also no public events anymore. The fitnesses had to close, and there were no parties anymore for marriages and so on. So what I want to say is you need very specific local contact tracing and source research. And if you do not have that properly done, you need very often very severe measures, as we see now again in Belgium, as we also see in Paris, Madrid, and so on. So that's the reason why I really believe, and I'm convinced of the importance of using information and data. You can go to the next slide. You will really need up-to-date, very performant data to tackle this crisis. You go to the next slide. And why is it? You need, and what is the main importance of a pandemic is you also need behavior change. That means that you need knowledge, insight, data to build on that knowledge and insight, also to share that insight and knowledge to make sure that people change their behavior, adapt to these 6 golden rules, as we call them, but also to, and I didn't mention that, but it comes later on, and it was also mentioned already by Bart Preneel, to really break or breach the chain of infections. That's the only way to do it in a successful way. Next slide. So yeah, the information, well, I think you have to make a distinction between information that should be available for all and then information that needs to be available for specific targeted groups, so to say. First of all, the information that should be available for all on a very easy way and a very excessive way. Yeah, next slide. Yeah, well, we do not have it yet in Belgium, but I'm very, I must say, jealous to what the Netherlands provide for the entire population. I know that the Netherlands are still above Belgium on the incidence of new cases a day, but still, at least you have there a very interesting applications that show you all the information on where are the specific clusters. You have the totals, you have the incidence, you also have the increase. You can look and take a look at the municipality, and I know we also have it in Cienzano, but still it is, this is more precise, more specific, and also you can have, and that's due to the fact that we have a complex federal state, we have like two instruments. We have the Zorgcontroletoren, the Controletoren, which is a Dutch, a Flemish instrument, where you can see and have some information on collectivities and on clusters. And then separately, you have the more macro data on how many cases a week, the incidence of cases a week. So I really hope, and I'm long for, and I just mentioned also to our new Corona commissioner, governmental commissioner for the Corona and COVID crisis, to have an integration of all this necessary information all together, which is very easy for people to understand. Okay, what is the situation in a certain municipality? What are the figures that needs to have our attention? The positivity ratio, the reproduction number, and so on. Everything very well included and integrated, so that people know how risky it might be to be at a certain place, or how risky it is to organize an event in a certain municipality. Again, macro data to make sure that people know, or at least understand more or better, or can understand more or better, what are the risks at a certain place, and also what are the sources. And I come back to that. What are the sources of contamination? Yeah, next slide. Well, again, why is it is also, I think, very important to, again, day after day, day after day, repeat the essential information that everybody has to be very aware of. I do not have to repeat them here. I think everybody is well informed about those six golden rules. I hope there are six on it, probably, but yeah, on the six golden rules, which needs to be repeated, I think, every day. And I'm very happy. Bart Preneel also showed it and mentioned it, that you have some epidemiologic information, and I hope it will be more and step by step more and relevant information, but also some of those six, not all, and probably they change every day, I don't know, but anyway, I use the app and I use it with, I downloaded it the first day it was available, but I think it's very useful also to keep on informing people on how and what is the best possible behavior to avoid getting sick, to prevent you of being infected, although I know that there is, of course, no zero risk. Next slide, please. Okay, so also information available that should be available for all, I think, and that is one of the main issues, and I think the main weak spots of our way of dealing with the crisis, was also yesterday mentioned in the standard, is really having the good information on the sources and the context of contamination. As I mentioned, we focus a lot on contact tracing, and yeah, a bit also on the control of source research, but a retrospective source research is not done yet, which is a pity, because that's the most important information that you can have. Also, and I connect it with the next slide, but it comes later, the information on the viral load of people. You probably saw it also in the beginning of Bart Preneel's, and I'll show it also in a picture that I have myself. You have people that have a very high viral load, so that means that they are more contagious than many other people. Of course, their names don't have to be known. Of course not, otherwise there would be a great issue of privacy. But I think it is interesting for them, and it's also interesting to know, and comes later on. So for them, and that's what I mean, you make a bridge between what is the knowledge that everybody has to have and what is the specific information that specific people need to have. But the sources of contamination are really of a major importance in the context as well, to understand outbreaks, to understand clusters, because you need it to do good risk communication. So, and I was, I hoped, but took that dream away, and also I'm an illusion armor, so to poorer, an illusion poorer, so to say, because I hoped also that also for research and for retrospective source research, it would be possible to use technology with location data, but I understand now that it is very complicated due to the privacy issue with the law. But it's for me, it's very difficult to have to balance between really privacy and what we really need to tackle this crisis. So it would be great one day to find a solution on GPS application location data without interfering and without breach on the privacy, to make sure that it can also assist and also be of a support to do a better source research, specifically a retrospective source research. But that, if that could be done in an anonymized way, that would be great. But anyway, I hope that also the researchers in Leuven can find a solution on that as well. And also in Japan, I know in Japan they do it, and that's what I mentioned, what was in our newspapers yesterday. It was a great article in the Standard. Okay, then next slide, if I may. So that's what I just mentioned. So it would be good to have like the information on, you have somebody A, and then you can see where he all was, people having enough distance, not enough distance, that it would be possible one day to really have clear and good information on what are the sources of contamination, because now more than 50% is considered to be contaminations within families, within households. Very interesting to know, but somebody was first to bring it in the family, in the household. And that's what I really want to know, to have the profile of people who bring it into the family. And now we know that then all the members of the family got infected, or very often all the members of the family got infected. But I think for risk communication, so for people responsible for emergency policy and emergency management, and for also the good communication, it is very necessary to know what are the sources, so that you can at least talk to people, convince people to see the risks, to understand the risks, and to, if one day we hope so, to also avoid more risks than they take today. And also then we can, there's a big discussion now in Belgium, are people infected in bars and in cafes, yes or no? Because now there was a decision taken that cafes and bars and also canteens in sport clubs should close their doors at 10 or 11 in the evening. Yeah, of course the bars and the pubs say, why should we close? When you see all the figures and all the research which is done on sources of contaminations, bar and pubs are not in. But in the Japanese study, they mentioned, okay, but if you ask people where they got infected, or where they were, or they might got infected, they hardly mention bars and pubs, because they know if they tell so, yeah, it will be used as an argument to close the bars where they really are keen to go to. So this is tough. And that's also what the Japanese was mentioning. You have to give a reward so that people understand that it's important. And that's probably also the way to avoid that they have to close and that you need firm measures. Next slide. As I mentioned, first you have information that should be available for all sources, risk management, risk communication, but also the generic macro information. But then I think you need also targeted information for dedicated doctors. I mentioned AZG, which is our agency Health Flanders, afdeling zorg en gezondheid. So it's health and healthcare, and then ALZ, which are the zones, the first line zones, first line health zones. There are more, it's like 1 or 2 or 3 municipalities, or within a city, which is a big city like Antwerp, we have like 4 ELZs for the entire of the city of Antwerp. Is more than 500,000 inhabitants. So, which is very interesting because it's a network of those of the first line, the family doctors, together with some nurses and so on, and that are the ones that really know their society very well, that very know the context, the social context, the social economic context, know where are the communities with a migration background, have volunteers working with them to make sure that they really can have a good contact tracing. They can call them in their own language. They can send people over there to talk to them, to have also the confidence, because I think confidence is of major importance. And then, of course, you have also Cienzana. But very interesting here is that, of course, people need to have a medical, medical, um, not the right to tell, to medical, I don't know the words by heart now. They have to keep it secret, medical secret, so to say, so that people can be reassured that the information will not be shared with others that are not doctors. Next slide. So that was what I was mentioning about finding people that are most contagious, people with a high viral load, which of course is the most important. You have very often asymptomatic people, very often young people, well, not always, but can be, in their 20s or in their 30s. So if they work, for instance, in a bar, in a restaurant, in a pub, many people come and go. If they take care of guests, okay, they can be responsible for a lot of people getting infected by COVID-19, Corona-COVID-19. So what you need to know is what is the viral load, the CT value of those people. And I think it's very interesting that doctors know, but also that those people themselves got the information on how contagious they are. So it would be interesting, I do not know, Bart, whether that will be possible to really ensure or to really convince them that even that, especially for them, it is of a major importance that they really keep self-isolated at home, or, well, if you are infected already, that's not a quarantine in Belgium, but then quarantine is also for the high risks, so that they really are convinced that they have the key in their hands to really contribute to the breach of the chain of infections. And of course, also you have to treat the right people in time so that they do not get severely ill. Next slide. I think I'm always, yeah, that's just to say that, well, the most dangerous thing that you can do is to keep on driving blind, so that we really need that information on a macro level, but also on a micro level. And so I keep on telling it also to the national Security Council, and also with the commissioner, the new commissioner, in the hope that one day we'll get there. And then the next slide, I think you're always almost done. Yeah, as I mentioned, of course, they are very probably unnecessary thresholds. Of course, I know that privacy is of a major importance, and I know that in Japan, in Singapore, I think they work more microscopic way of methodology to tackle the crisis. Also, they've learned from the SARS crisis. But if we do not have these instruments that I just mentioned before, I think we have to keep on taking generic measures with a huge, large social, economic, and also social impact. So that's the reason why I'm really convinced of the major importance of technology, but also combined with what I just mentioned, the local way of working close to people, very close to people, people that know the environment, the social, economic context of people, know that, well, also the communities, the language, people, volunteers that know the language, or doctors that know the language, to really have that confident relationship and the confidence that they really want to join on source research and on contact tracing. So that's the story.
Thanks, Cathy.
Oh yeah, the last one, the importance
sorry.
of data. No, it's just a quote. It's just a quote. Yeah, that's it.
So yeah, thanks, Cathy. Just a quick one as we are over time. I suppose that you agree that an app exchanging with the other European apps is recommended, but that the advertisement around it and the manual tracing should be more on a local level, just to go to the specific communities or specific regions or cities?
Well, I think it's complementary. You have both. So when you do it on a regional level, you can reach out to a more standard patient. I think it's N and N. You cannot just choose for one. It's also mentioned by Bart Preneel. You do not have a golden bullet to solve a complicated pandemic as we are in. So simple solutions for complicated issues, I never ever believe them. So I think you really need a combination, a good combination, a complementary combination, also due to the fact that on a more regional or national level, you have to have all the data connected, being able to connect to see the big lines and also to see some similarities. But you also need the very, very, very local approach to make sure that, especially when you have outbreaks in communities, that you can tackle them close to the people, with the people, in good communication and interaction, and in good trust.
Yes. Thanks, Cathy. Yeah, yes, Kathleen, you wanted also to...
Yes, well, thank you for a very interesting presentation. Well, I was wondering, there is a population of the willing also to share information. And as we see, information is crucial to address this pandemic, but also in the general context of personalized medicine. So can you envision a system where you can combine the two systems, the tracing app gathering strict privacy, but also, for instance, agreeing that if you enter a pub or a restaurant, you have a barcode to scan, a QR code, so people know you are there. You cannot lie about it, instead of this voluntary registrations we have right now in bars and restaurants. And if you go to a bar and restaurant, you would give access to the data that you go there, but only for strict purposes of following the pandemic. Is that because you would combine then the stricter follow-up in Asian countries for the voluntaries under us? Thank you.
Yeah, well, I think and I believe that what I read yesterday in the newspaper, and I must admit that I forgot his name, that Oshitani mentioned that it should be, in one way or another, rewarding, also very in the interest of people that go to a bar or a pub, to be able, or no, to be willing to tell that they were in a bar or a pub. Maybe I do not have to know what pub it was, so the QRs, but at least we need to know what are the most risky places and to understand risky situations, to make sure also that people can adapt their procedures to make it less risky. But that's probably also very difficult. But what needs to be also done, I think, is to make sure that collaborators in bars or pubs, at least when they get symptomatic or when they have an issue, that we know for sure that they keep themselves to the home isolation or to quarantine when they are in risk. So I don't know. It's what I do know is in Singapore, but I do not know whether you can compare our democracies or our countries with the way of tackling it in Singapore. Just, yeah, it's hard to say, but at least what is for me very, very important is to understand via retrospective source research, to really understand what are the main sources, where do people got really infected, and more than just family. Is it important to know which bar? For the bar, it's very interesting, but also there you see that our first line zones very often and also our mayors take the phone and are informed by the local crisis center and local crisis gatherings, and then inform them in another way. So maybe that's also a solution. Then you have the trust, and it's not just all in big systems. But we have to work further on it, I think. And every good ideas are more than welcome.
Thanks a lot. So